It's not good news when anyone has cancer. There's some things about this presentation that are worrisome. Number one is under a microscope, the cancer cells appear to be aggressive, and the way they describe that is that there's a high Gleason score. A Gleason score of 9 is that's on a scale up to 10. So a Gleason score of 9 or a grade group 5, that's two ways of saying the same thing, which is the cancer cells appear to be aggressive. What concerns me more than how the cancer cells look on our microscope is the fact that the cancer has been reported to have already spread beyond the prostate to the bones. And when the cancer has spread to the bones, that makes it stage 4. That means that the cancer is not curable. There's no treatment available that can cure the cancer. There's definitely treatment available that can control the cancer, really good treatment to control the cancer. And I would assume that the doctors caring for the former president are thinking that way right now. So with prostate cancer that's metastasized to the bone, you could control it for years. 2 or 3 years is very realistic. And some lucky patients get control for 4, 5, 6, and even longer. So I would assume that the president or former president gets a very thorough physical every year. One of the best screening tools that we have to detect cancer is called the PSA. That's a blood test that looks for cancer. I would be interested to know what his PSA was the last time it was checked. It's sort of hard for me to believe that if he's had a PSA within the past year that was normal. It's possible. It's definitely possible. But that would surprise me. Usually prostate cancer doesn't, go full throttle like this too often. When it does, that's usually a bad sign. That's an aggressive cancer for sure. But it does seem odd. When you lower that amount of testosterone, we call that androgen deprivation. It's very effective controlling the cancer. It almost always works. You can expect the patient to feel better, have a lower PSA, the scans look better. But what it doesn't do is cure the cancer. So at some point, that strategy will stop working, and we can cross our fingers and hope that it works for many years. If we're unlucky, it might only work for 6 months, 12 months, but that would really be disappointing.
For individuals that have metastatic prostate cancer, the 5-year survival is about 37%. In individuals that we diagnose with low risk or average prostate cancer that's localized, that hasn't spread anywhere, that gets treated, it's close to 100%.
Well, the cancer, it might not be causing any symptoms right now. If it was, sometimes patients have weight loss, fatigue, bone pain, sometimes urinary symptoms, sometimes, but it might be asymptomatic. The treatment, the hormone therapy that I'm pretty confident the president will get, it lowers the testosterone, and when that happens, it can cause hot flashes for sure. It can cause fatigue. It can affect your heart. It can affect the strength of your bones. Those side effects are likely. In someone who may have some baseline frailty or baseline cognitive dysfunction, I would worry that the hormone approach might make those symptoms a little bit worse.
In a lot of patients that get diagnosed with metastatic prostate cancer, the treatment usually starts the day of the diagnosis. So patients may start on their androgen deprivation therapy, which is pretty much like hormone castration. So we're trying to slow down the cancer, which can be fed by hormones or testosterone. So the treatment starts there, and then as more evaluations are being given, and as they see more specials, as we're expanding the team, more things may be added based on what that specific patient needs.
The question I was expecting is whether this diagnosis might explain the president's decline over the last 2 or 3 years. And my belief is probably not. I don't think he had cancer the last 2 years, and that's why we saw physical decline on television. I think probably that happened from something else, and this cancer just happened to be diagnosed.